Hello and welcome back to the Hatching for Health show, where our mission is to create a platform for people to share their stories, to educate the public, and to build a more compassionate community. And I'm your host, Jessica Hatch. On today's episode, triple board certified cardiologist, Dr. Khalaf is joining us to discuss heart health and the importance of having a doctor who truly fights for their patients. We're going to explore what it means to advocate for yourself, navigate insurance challenges, and ensure that you get the care you deserve. Dr. Khalaf is a leader in interventional and structural heart medicine, triple board certified in internal medicine, cardiovascular disease, and interventional cardiology, and he was trained entirely at the Houston's prestigious Texas Medical Center. Dr. Khalaf has served as Chief Cardiology Fellow, Department Chair of Cardiovascular Medicine, and now leads the Structural Heart Program as Medical Director for HCA Kingwood Medical Center, while also serving as an Associate Program Director of the HCA Cardiology Fellowship. Known for his expertise and dedication, Dr. Khalaf is recognized not only for performing advanced cardiac procedures, but also for advocating relentlessly for his patients, ensuring they receive the care they need, even when insurance barriers get in the way. So we're excited to have you.
Thank you, Jess. Thanks for being here. Thank you for allowing me to be here.
Absolutely. I know this episode is a little special because we actually have a patient of yours going to be on after commercial break, which will be really unique to be able to talk about their experience with you as their doctor firsthand. So, but tell us just a little bit about your practice and all the intricacies of what you do.
I'm an interventional cardiologist with Vital Heart and Vein. We are the largest private practice cardiology group in the greater Houston area. And I've been working with them for almost 10 years now.
Incredible.
Yeah, thank you.
Yeah, you guys are even treating my mother-in-law, which it's been a wonderful experience, honestly. You've really, like they said, fighting insurance, all the things that describes is what you've been doing.
Yeah, you wouldn't believe the hurdles we have to face. And this case will allow us to present that too.
Yeah, no, it's wonderful. And so within your practice, that one location is where you're basically seeing patients on a regular basis. Yeah,
that location off of 59 and 1960, that's our main medical office building, but we have clinics all throughout Houston.
Okay, do you actually travel around to the...
I do, I go to the medical center and in that building.
Okay, that's awesome.
Yeah, thank you.
Yeah, and your patients range from like what age range all the way?
We see, typically my patients are on the older side. Okay. I would say 50 plus, but definitely, we see patients in their 20s, 30s. Teenagers not so much, but yeah.
Right.
Sure.
So, just with like all the different checkups, like I know with different specialties, the importance of like at this age you want to do this, at this age you want to do this. What would you say, for young adults, like when is it that they should, come in to see you and get, they're basically kind of physical for their heart? Sure.
Well, currently, the guidelines do not recommend a universal screening by a cardiologist ever.
Okay.
It's only if you have symptoms that are concerning or if you have major risk factors. And those major risk factors, as most of the population knows, is the elevated blood pressure, blood sugar, cholesterol, not sleeping well, high stress, age and family history. Those are the main risk factors that we have.
So it's really when those symptoms come up that people should basically come in?
Yes, cardiovascular symptoms, basically chest pain, shortness of breath, dizziness, pain in the leg. We're also a vein specialty clinic as well, so we deal a lot with that.
Okay, okay. Yeah. That's good to know, because I feel like so many people where they're like, they go in for just a scenario with a recent friend of mine talking about, he went in for gastroenterology, like for the colonoscopy, and it was like at 45, and luckily they're going to like save his life, but they got to remove half his colon. But it was something that he was like, I should have gone at 40, So you always wonder, because people do come into you and it's like, oh, I wish you had come a few years ago,
For sure.
They should create some type of universal.
That's what I believe, but maybe I'm just a biased cardiologist.
Yeah.
But no, I definitely feel like, and I always say above the age of 50, anyone, man, woman, especially with risk factors, and especially again if you're having symptoms, you should get checked out by a cardiologist. And this isn't anything like a dig towards all the other physicians out there, but what we do is highly specialized.
Of course.
So the testing that we order, the types of diagnosis that we give, it's really not like a universal thing. So a lot of people think just because they routinely follow up with their primary care physician that everything's okay. And actually there could be a lot of stuff brewing inside and they wouldn't know because they don't do most of those in-depth screenings that we do.
Okay. And so the difference in like cardiologist and interventional cardiologist, you're actually going in there, you know, with the camera and doing like entire procedures like within the heart, like what all that entail, like stents and
so you have cardiology, right? You have your general cardiologists, and then there's specialties within cardiology. The big ones are interventional and electrophysiology, plumbers and electricians. So I'm a plumber, and I always tell people I'm a plumber, and typically what interventional cardiologists do are coronary angiograms and putting stents in people's hearts. But the whole field extends way beyond that. For example, you know, structural cardiologists, we do aortic valve replacements, PFO closures. I'm dealing a lot now with the renal arteries these days, and then fixing blockages in the legs. So basically, if you give me a needle and a wire, I can get anywhere.
Yeah, it seems that you do a lot more of that than just kind of seeing the patients. You're doing a lot of interventional stuff.
Yeah, hands-on, for sure.
On a daily basis. I've seen some of your videos that you post, and it's like wild. It's scary. It's like
it is, and it's new. It's the other thing too, Jess. It's new. It's a new sort of field. I mean, 20, 30 years ago, this stuff did not exist.
It was like they're having to completely open up to do surgery on someone. Versus
Absolutely. No, the amount of patients that used to go for open heart surgery versus today is not the same because technology is better, the doctors are better, the skills are better. It's actually it's a good time to be alive.
Yeah. Right. So let's talk about this condition, PFO, and that stands for patent foramen ovale?
Patent foramen ovale.
Okay.
Yeah.
Okay, so tell me about it. It seems a little rare.
Well, it's not. It's rare because no one knows about it. But actually, 20 to 30% of the entire population has one. I could have one. You could have one. Oh. We don't know because the only way to find it is through this. It's an echocardiogram, but it involves an extra step. In most echocardiograms, you just put a probe to the chest, almost like you're having an ultrasound. With pregnancy, we do an ultrasound of the heart. But you cannot detect a PFO with just a simple ultrasound. You have to put an IV and perform what's called a bubble study. And we don't do bubble studies unless we're looking for a PFO.
Okay.
And we don't look for a PFO unless we have a reason to look for a PFO.
Right.
But it's super common.
Interesting.
Yeah.
And so what would be someone's like symptoms or the signs for that?
There are none.
This sounds like a mystery.
Yeah, no.
Like,
so that's...
like, we don't do this unless we know this, but then, no
so let me tell you like what a PFO actually is, and it'll make a little more sense to the audience. A PFO is a hole in the heart. Usually when people say hole in the heart, that's what they're talking about.
Okay.
And so when you are developing in utero and when you take your first deep breath as a newborn infant, what happens is the pressure on the left side of the heart forces these two flaps to come together. It's called the septum. You know how we have a septum in the nose? We talk about deviated septum?
Of course.
We have a septum in the heart. It separates the right side from the left side.
Okay.
And so when you take that first breath and then the two flaps come together, 80% of us, or 70 to 80% of us, those flaps will seal completely.
Okay.
And the remainder of us, it stays open. And that's what creates a channel.
Okay.
Now the channel in and of itself does nothing. There's no symptoms. The only reason why this could potentially be dangerous is because it allows a conduit for microclots to pass from the right side of the heart to the left side. If you get a microclot in the left side, your heart has to pump it somewhere. It has to end up lodged in an artery somewhere. And a lot of times, unfortunately, it goes up to the head and neck area.
Wow.
And so you end up with strokes and mini strokes.
Really?
Yeah.
And so that's basically because that space that's there, the pressure that, I guess, when it's trying to kind of pump?
No, it's just that it didn't seal. And so there's basically a channel where there shouldn't be a channel.
And is that, going back to the I guess, PFO, is that considered a hole? That's the hole, okay.
Yeah, channel hole. Sorry.
So it's kind of like a long hole. I mean, there's a lot of, space. And that's just something that happens basically right when you're born. It's like kind of that final step of your heart.
Yeah, it's your heart's where you did not seal properly.
Okay.
And there's nothing you can, it's not your fault, basically. It's just, I guess you can call it a congenital heart defect. I know it's a little harsh to say that when 20-30% of us have one, but technically it is, yeah.
And does that sometimes never cause any issues your entire life?
Most of the time, most people have them, you have no issues at all.
Okay.
Zero.
Right.
But if you are young and you end up with a stroke or a mini stroke or anything even remotely related to strokes, you should be screened for a PFO.
Okay.
And a lot of times that doesn't happen.
Okay.
It's sort of a mystery, like you said. A lot of it's not well known amongst the medical community, and definitely not well known amongst the population.
We had the American Heart Association on about a month ago, and the young lady that spoke, she basically collapsed, like she was a cheerleader at U of H and collapsed, and turned out she had, I guess, a PFO. She had a hole in her heart, and like that's what caused that. But like she never really had any symptoms from that, you know?
Right.
She was like, small things that would occur, but I never thought much of it, and then that happened. So it's, you know, and that was like, she's in her like mid-20s. Yeah,
and I would say this though, there is somewhat of a correlation between migraines and PFOs.
Really?
Yeah, it hasn't been fully proven, and having very bad migraines is still not indication enough for us to close them. But there is something there, for sure. So when it comes to symptoms, I guess that could be one of them.
So I guess for, you know, just anybody watching, like what advice related around that condition would you have, you know, for individuals that might have a symptom pop up?
If you are young, let's say less than 50, and you've had a stroke or feel like you had maybe a mini stroke, we refer to that as a transient ischemic attack, where it doesn't necessarily show up on head imaging, but you've had an event, or even migraines, for example, then you should get screened for a PFO.
Okay.
And again, you really should see a cardiologist for that screening to occur.
Right. Okay.
Yeah.
Well, we are going to take a commercial break, but when we come back, we'll be joined by Tiffany, who's also a doctor, and we'll learn about her experience and how you helped her.
Yes.
We're going to take a quick commercial break, but before we do, I just want to say thank you all for watching and supporting the Hatching for Health Foundation. Because of you, we are able to provide free luxury medical transportation during the week and create amazing weekend experiences like sports games and special outings for individuals with unique medical needs. Our goal is to do even more this year, and we couldn't do it without your continued support. If you'd like to help us make a bigger impact, please consider donating at hatchingforhealth.org. Every contribution helps us provide moments of joy, comfort, and care to those who need it most. We'll see you right back here after the break.
Your private practice deserves more than sticky notes and missed calls. Funnel Cake MD is the HIPAA-compliant growth platform built for doctors and dentists. Manage calls, texts, and emails in one secure inbox. Book more patients, cut the admin chaos, and keep your front desk sane. Try it free for 14 days with full white glove onboarding so you're running smooth from day one. Don't let outdated software hold you back. Sweeten your growth with Funnel Cake MD. Start your free trial now at funnelcakemd.ai.
Funnel Cake MD, all-in-one tool to grow your practice.
I'm Jessica Hatch, and together, Hatching for Rides and Dream Rides are working to make sure children get to their medical appointments and also experience joyful weekend rides that remind them they're just kids. To support this mission, we're hosting our inaugural Hatching for Rides charity golf tournament this February 26th at Southwood Golf Club. It's a fun morning of golf with an 8 a.m. tee time, exciting prizes, and a hole-in-one chance to win a Mercedes-Benz E-Class. Every golfer, sponsor, and donation helps keep these rides going for the families who need them most. Join us on the course or donate today.
Welcome to Arabella Chiropractic. We are located right here in the heart of Houston, right down the street from Lakewood Church off 59 in Edlow. We welcome you to come visit us for any of your chiropractic or physical therapy needs. We have a licensed massage therapist on board, as well as a tech that's trained to do our ultrasound and stim with hot packs. We also offer physical therapy and, of course, the chiropractic visits, where you can get adjusted and discuss any of those aches and pains to see how we can better help you feel better. Here at Arabella Chiropractic, we want your experience to be amazing. So come see us here at Arabella Chiropractic, where you can discover wellness through chiropractic excellence. Welcome back from the commercial break. Now joining us is Dr. Tiffany Su, a board-certified anesthesiologist, aesthetic physician injector, and medical director based here in Houston. She is the founder of Skin Shop Med Spa and a nationally recognized expert and educator in aesthetic and regenerative medicine. Dr. Su is here today to share how a sudden loss of vision led her to uncover a serious heart condition. Through her determination and advocacy, she fought to get the care she needed, which resulted in an unexpected diagnosis and life-saving surgery performed by Dr. Khalaf. How are you?
I'm good. Thank you
What
so
an
much.
intro.
I
Yeah.
know. I'm sorry.
No, it's, going from being a doctor and, knowing all the things to having like your own emergency situation. It had to have
Right.
been very scary.
Right.
But thank you for being here.
Thank you for having me.
Yes, we got to meet at a lovely event and walk in a fashion show together. It was
Yes.
very much a pleasure.
Yes, women in medicine.
Right, right. So before we get into your story, just tell us a little bit about your practice.
Okay, so I basically do aesthetic injections, which you think of as like Botox, fillers, microneedling, skin treatments, hair care, skin care, things like that. So I used to do anesthesiology full time, but I've transitioned completely into aesthetic medicine.
Okay, very nice. What do you like better?
Oh, definitely aesthetic.
Okay.
Oh, for sure.
Yeah, I think that's a little more exciting.
Yes.
The other is, a necessity for everything, but
Yes.
what you're doing now, the elective patients, they're more excited to come in and get something.
It's a lot of fun.
Done.
Most people don't want to have surgery
Right.
unless it's cosmetic surgery. So usually when I'm seeing a patient, it's not like a happy occasion in which they're having surgery.
Sure.
So it's a little different. Most patients who come see me in my office are very happy to see me.
So when you left kind of doing the anesthesiology, or anesthesia, did you kind of open up a practice right away, or did you work at another spa, or how
Right.
did you kind of transition there?
I transitioned by actually taking some aesthetic classes, getting better in my skills. I worked as a medical director in another office in California, and then in 2020 I opened up my office, and I started working there part-time compared to working now, which is full-time.
Great, very nice. So tell us, let's take us back to this moment. This was a moment of lost vision for you.
Yes.
And just from thinking like emotionally versus clinically in that moment about your own individual self, like I guess take us back to that moment and what happened.
It's really odd. So I'm like a night owl, and I do suffer a little bit from insomnia. So I was up at night, and I actually didn't know what was happening. So, at the wee hours in the morning, you're like, am I seeing things correctly? I'm covering my eyes, and I'm trying to make sure that what I'm seeing is actually what's happening. And I basically lost vision in my right eye, and it was in the upper hemisphere. And so it was kind of concerning because I realized I wasn't hallucinating because I was basically doing, what you do when you see an optometrist, they check your vision. So I was, of course, like doing this with my vision, and I couldn't see out of my right eye, my hands, my fingers on the upper part of my vision. And I realized that something's definitely wrong. And at that time, I thought I was having a retinal detachment because I have myopia, I'm nearsighted. So I've always been told, wearing contacts when you see your optometrist every year, make sure you don't have like a curtain effect. So then I thought maybe I was having a retinal detachment. So then I thought we should go to the ER as soon as possible. But then over the course of 10 minutes, it resolved. It kind of traveled. In retrospect, I realized it's the clot that was traveling in my ocular artery, and it was traveling up to the right upper quadrant, and eventually just dissipated.
How scary.
But after the 10 minutes and I regained all vision again, I decided let's just wait until the morning and call the ophthalmologist to see if I can get an appointment to look into what happened.
So that next morning, you're like, it's my eyes, ophthalmology, that's who I call.
Correct.
So did you go in and see them?
No, I actually couldn't get an appointment. It actually, even as a physician, it's difficult to get an appointment. So I called my optometrist, and she was able to give me a referral to her ophthalmologist that she refers patients to. She made a courtesy phone call for me, and I was then able to get an appointment in about 2 weeks.
Oh my goodness.
Otherwise, it would have been like a 3-month process.
That is
It's really hard to see specialists.
That is really interesting. So what did they tell you at that time? So between then, you had no other issues or symptoms come up again?
No,
with your
thank
eye?
God, no. I was on alert in case it occurred again, but again, we didn't know what I was dealing with. And so when I went to the ophthalmologist, he actually had a fellow who thought I had an ocular migraine instead, which can present similarly. The symptoms can be the same, but the more experienced ophthalmologist really didn't think it was an ocular migraine. Ocular migraines can cause momentary blindness as well. And he basically told me I really needed to find a cardiologist to look into
Good for him.
what I had. Yes.
Yeah, because I
Yes.
would never connect the two, thinking to get a referral from an ophthalmologist, you know what I mean? But he knew what he was talking about.
Correct, yes.
So at that point, did you think of your friend here, Dr. Khalaf, or you're probably like, oh wait, I have a friend, but he's actually wanting to see.
So I actually didn't see him for the diagnosis. I wish I did. We've been friends for a while.
Long time.
And I don't know why I didn't think about him, but I have been seeing another, before I even knew you, I was seeing another cardiologist. Right. And I just decided she was the cardiologist of my mom, my dad, so then I thought, okay, I'm just gonna call her. So it's like jumping through hoops to really figure out what you have in terms of getting insurance approved. So when I told her exactly what happened, and she suspected maybe I might have a PFO. And at that time, doing the routine tests of having a transthoracic echo wasn't enough to diagnose anything. It was completely normal, as Dr. KK had mentioned, that you really need to have a bubble study. And I didn't have a bubble study, so everything was coming out normal with my studies initially.
Okay.
So
even though you were going in for that with looking for a PFO, wouldn't that normally make them do
it should. That's what.
Okay. Yeah, that's.
I don't know.
It should.
Okay.
Yeah.
It's usually like the additional thing.
I mean, in their defense, the
insurance too. They might say, "When you do this first,
you could potentially see a shunt with colored Doppler, but the hole is so small. Without a bubble study, you cannot really make a definitive diagnosis one way or the other.
Okay.
Yeah.
So then you did it the one time, and then after that, what did
It took about almost a month to get approved for a transesophageal echo, where they take a scope down my esophagus and do a bubble study to then confirm that I have a PFO.
Okay.
Yes.
So, and at this point, you are not having other symptoms, but you're still scared because that was a very, crazy moment for you, and you want answers.
My main thing is I just didn't want it to happen again, because ocular blindness, it's almost like having a stroke. I had a TIA, like a transient ischemic attack. It went away. So I had like a mini stroke to my eye that went away. So I was basically worried that I would lose my vision.
Yes,
and I just didn't want that to occur again. So I was pretty adamant about getting things done. So after finding out that I had a PFO, I knew at that time I would need to see an interventional cardiologist.
Okay,
and,
so your cardiologist was just, they didn't have that.
Correct, she's not she does not do closures.
Okay. So then you found Dr. KK.
It's so funny, actually.
Yeah.
I found her.
Okay, so how did that? Yeah, something about a Facebook post.
Oh my goodness!
No, tell him it's cool. I've known Tiff for a long time, and I saw her story, and I was like, "What? What are you talking about? This happened to you, and you have PFO?" I was like, "Wait, and then that's kind of what led to."
Okay.
I posted on my social media, so because of my aesthetics practice, I was explaining to my patients why I would be absent, why I needed to take a few days off.
Of course.
And to also kind of educate them as to what I had, and maybe hopefully, remarkably actually, after I posted my story, a few of my patients and a few people who followed me came back and said, oh my God, I had the same experience. I had a PFO as well. And others who said, I have the same thing. Oh my gosh, am I having this issue as well? So the good thing is he then reached out to me and said, why is the whole world finding out about your PFO before me? What the heck, Tiff?
I was slightly offended, by the way.
Oh, yes. No. Yes.
So you got her in immediately?
Oh, yeah.
Yes,
okay.
he did.
Oh, yeah.
And then what did that look like? Because I know insurance became a big factor for you.
Oh, my goodness.
Most PFOs, when you have a cryptogenic stroke or paradoxical embolism, it goes to the brain.
Okay.
In Tiff's case, it went to her arteries of her eye. And so the insurance companies will do everything in their power to not approve things, whether it's testing or a procedure. It's just kind of what they do. It's more like a robotic checklist thing. And so we submitted off to have the PFO closed, and it was initially denied. And so what would they make you do is do what's called a peer-to-peer. It's a phone call that I have to make with another physician out there who's supposed to be sort of at the same echelon in terms of knowing what I'm doing and what I'm talking about. But sometimes we end up doing peer-to-peers with a doctor completely unrelated to our field. This peer happened to be a cardiologist, and I didn't know him, but he knew me. Ironically, he came and did a course with me one time for the vein procedures. It was just total. He doesn't even live
like a fluke thing
in Houston or anything.
His peer was fanning
him. And so it was funny because you could tell he was trying to deny it, but also trying to help at the same time. And so part of their checklist is, if you're going to close a PFO, you should really have the sort of opinion or approval of a neurologist. And that's kind of what she was missing initially. And I told him, I said, she didn't have a stroke of her brain, she had a stroke of her eye. I said, why are we sending her to a neurologist? There's not going to be anything there. And so that was enough for him. And I said, she saw an ophthalmologist, that should be enough, which diagnosed the arterial occlusion. And so eventually, we were able to get it approved. But it did require some finagling, and had he not known me, we could have ended up even more delayed. Yeah, I suspect that. Yeah, for sure.
Well, just so others can find you guys too, because you're individually, phenomenal doctors in your own way. Where can they find you?
At www.skinshopmedspa.com or at Dr. Tiffany Su on Instagram.
Okay, and Dr. KK?
Vitalheartandvein.com.
Okay, wonderful. Yeah. Well, thank you guys so much for being here and sharing this story. I think
thank you, Jessica.
There's probably a lot of people you're going to help, so thanks for being here, both of you.
Thank you. Thanks for having us.
Thank you. Thanks for fixing me.
And thank you all for tuning in. It is time for our Golden Weekly raffle. This week, one lucky family will enjoy a fun-filled day at the Downtown Aquarium, Houston. You'll receive tickets for a family of 4, and we'll drive you there and back in our wheelchair-accessible Mercedes Sprinter van, so everyone can ride in comfort and style. Just DM us on Instagram at Hatching for Health. That's the best way to get in the running. And if you or your organization would like to donate tickets for future experiences for our raffles, please reach out to us on Instagram as well. Your support helps us create inclusive, memorable experiences for our families in the community. Before we go, we want to invite you to our first ever Hatching for Rides golf tournament on February 26th at the Southwick Golf Course. It's going to be an incredible day and a great cause. Get your tickets now before they sell out. And for more details, you can check out our post on Instagram at Hatching for Health. Your support helps us continue providing luxury medical transportation, weekend experiences, and unforgettable moments for individuals with unique medical needs. From all of us at Hatching for Health Foundation, we're so grateful for your support, and we can't wait to see you next week for another inspiring episode. I'm your host, Jessica Hatch, and thank you for watching.